Hello, my name is Colin Richards, and I'm here today to talk about ophthalmic health disparities in glaucoma. My co-contributors are Dr. Sankar, Dr. Ross, and Dr. Goyle. We will speak briefly about what defines the disease of glaucoma, who is affected by it, the factors that decrease access to care, and we'll touch on some interventions to overcome barriers to access. Glaucoma is defined as a chronic progressive optic neuropathy with progressive retinal ganglion cell death and visual field loss. Normal tension glaucoma is a variant of primary open-angle glaucoma that is characterized by a normal IOP. Narrow-angle glaucoma is a result of aqueous outflow obstruction at the peripheral iris in an anatomically predisposed eye. The severity of glaucoma is determined by changes of the optic disc, retinal nerve fiber layer, and visual field abnormalities. Let's talk about risk factors for the development of glaucoma. High IOP, or ocular hypertension, and older age are strong risk factors. Among those with high IOP, thin central corneal thickness, older age, higher cup-to-disc ratio, as seen on the right, and higher pattern standard deviation on Humphrey visual field are also associated with the development of glaucoma. Those with a positive family history, Black Americans, and those of Hispanic or Latino race are also at a higher risk. Asian Americans are at a higher risk for all forms of glaucoma, especially narrow-angle glaucoma versus whites. Among those that have glaucoma, the risk factors for progression include older age, higher IOP at baseline, thinner central corneal thickness, and potentially diabetes. The goals of management for glaucoma are centered around preventing visual field loss and include controlling and lowering IOP through medications, laser, and surgical approaches, achieving stable optic nerve and retinal nerve fiber layer, and achieving stable visual fields. So population health in glaucoma. This is the second leading cause of worldwide blindness, and blindness from open-angle glaucoma is estimated to affect 5.9 million people globally. In the U.S., among those 40 and older, nearly 2% have glaucoma. The prevalence is highest among non-Hispanic Black Americans, and it is estimated that 55% are unaware of their diagnosis. It is estimated that 7.3 million Americans will have glaucoma by 2050. Studies have also indicated that the prevalence of glaucoma varies widely between different populations. Healthy People 2020 has a goal to reduce visual impairment due to glaucoma by 10% from 2010 to 2020. Groups at high risk for glaucoma include Black Americans, where POAG is 3 times more prevalent, begins at an earlier age, they are less likely to receive treatment for, and they are 6 times more likely to suffer blindness from compared to white Americans. Latinos have similar rates of glaucoma compared to Black Americans. Asian Americans are at a 50% higher relative risk versus white Americans and have significantly higher rates of normal tension glaucoma and narrow-angle glaucoma, with differences in prevalence by Asian ethnicity. Non-Hispanic white women represent the largest group of those with glaucoma. Though with changes in the U.S. population, it is estimated that by 2050, Hispanic or Latino men will overtake them as the largest demographic, and Hispanic or Latinos will account for 50% of all POAG diagnoses by 2050. Screening for glaucoma is generally reserved for those at high risk, including older adults, those with a positive family history, Black Americans, and Hispanic or Latinos. Screening for high-risk groups has been shown to be cost-effective. Medicare and Medicaid have recently approved annual screening for those at high risk, including those with diabetes, a positive family history, Black Americans over 50, and Hispanic or Latinos over 65 years of age. Studies have identified common barriers to access among those with glaucoma, and they include younger age, lower healthcare knowledge or literacy level, Latino ethnicity, Black American race, Asian Pacific Islander race, less severe diagnosis and less severe disease stage, and not having a usual place of care or a primary provider. Additionally, lack of transportation or increased distance to clinic and difficulty navigating the medical system are all associated with a decreased ability to access care for glaucoma patients. Lowering intraocular pressure through the use of topical medications is a cornerstone of glaucoma management, although almost half of individuals discontinue this therapy at 6 months. Cost is estimated to limit access for up to 41% of patients. Even with monitoring in place, almost half of patients are getting less than 3/4 of their recommended dosings. And the average cost per medication is high, with an average annual cost of $282 for generics and almost $1,200 for brand name medications. And intraocular pressure medication costs account for almost 60% of glaucoma treatment-related expenses. Looking at the patient perspective of glaucoma management, over half of Black Americans report trust as a barrier to their eye care. Many patients report feeling scared because they lose vision without symptoms. Almost 1/3 of patients have trouble with adherence to medications, in part due to side effects, and many patients report trouble with support systems that limit their access to care. Improving access to eye care for glaucoma demands that we look at the social determinants of health, where we know that knowledge about glaucoma is associated with having insurance, a higher income, and higher education. Socioeconomic status is also positively correlated with knowledge of risk factors, pathophysiology, and consequences of glaucoma, as well as treatments. Additionally, poor health literacy is associated with lower education, lower income, and use of public insurance. Looking ahead for strategies to improve access to glaucoma, we first need to mitigate barriers to care through transportation, reducing cost, improving insurance coverage, utilizing primary care physicians, and engaging individuals via a community-centered approach. Improving health education and health literacy may be similarly important, as this drives informed shared decision-making and may have the potential to improve eye exam attendance. A review for the primary care provider. Glaucoma is a chronic blinding disease that is asymptomatic until late in the disease course. Those at higher risk include those with high IOP, a family history, Black Americans, those of Hispanic ethnicity or Latino race, type 2 diabetes, nearsightedness, and those with lower blood pressure. Medicare and Medicaid cover glaucoma exams for some individuals at high risk. You should consider referring patients for a complete ophthalmological examination if they are at high risk. So some take-home points. Glaucoma is a chronic, progressive, insidious, and irreversible blinding eye disease. Some risk factors for the development of glaucoma include age, IOP, race and ethnicity, and a family history. Black Americans and those of Hispanic ethnicity or Latino race are more likely to develop glaucoma. They may present earlier and they may suffer blindness disproportionately. The estimated prevalence of primary open-angle glaucoma is near 2% in the United States, and that is expected to increase dramatically with demographic changes, and many remain undiagnosed. Annual screening for high-risk groups is recommended and is covered by many insurances. Common barriers to accessing care include cost, insurance, transportation, healthcare knowledge, race and ethnicity, lower socioeconomic status, and a younger age.